Spinal muscular atrophy, or SMA, is a rare genetic disease that affects individuals of all ages, from infants to adults. It is a condition that can have a profound impact on the lives of those who are diagnosed with it, as well as their families and caregivers. SMA primarily affects the nerves that control our muscles, which are crucial for movement and daily activities. These nerves are part of the nervous system, which is responsible for sending signals throughout the body. The specific nerves affected by SMA are called motor neurons. These motor neurons play a vital role in our ability to move by transmitting signals from the brain to the muscles, instructing them to contract and relax. In individuals with SMA, these motor neurons gradually weaken and die. This degeneration disrupts the communication between the brain and muscles, leading to a progressive loss of muscle function. As a result, people with SMA experience muscle weakness and wasting, which can make it challenging to perform basic tasks such as walking, eating, and even breathing. The severity of these symptoms can vary widely among individuals. The root cause of SMA lies in a defect in a gene called SMN1. This gene is responsible for producing a protein known as SMN, which stands for survival of motor neuron. The SMN protein is essential for the health and survival of motor neurons. Without sufficient levels of functional SMN protein, motor neurons cannot function properly and eventually degenerate. The lack of functional SMN protein leads to the debilitating symptoms of SMA, which can range from mild to severe depending on the amount of protein present in the body. The severity of SMA varies greatly among individuals. Some people may have a milder form of the disease with less pronounced symptoms, while others may experience severe muscle weakness and significant physical limitations. In some cases, SMA manifests in infancy, leading to severe muscle weakness and respiratory difficulties. These infants may require extensive medical care and support to manage their symptoms. In other cases, individuals may not develop symptoms until later in childhood or even adulthood. The progression of the disease can vary, with some people experiencing a slower decline in muscle function. Regardless of the age of onset, SMA presents significant challenges for patients and their families. It can impact their mobility, independence, and overall quality of life, requiring ongoing medical care and support. The diagnosis of SMA can be overwhelming, but advancements in medical science are offering new hope. Researchers are working tirelessly to develop new treatments and therapies that can improve the lives of those affected by SMA, providing a brighter future for patients and their families. Evrysdi, or Risdiplam, is an innovative oral medication for SMA. It represents a beacon of hope for patients and families grappling with this challenging condition. Unlike previous treatments that required invasive procedures like injections into the spinal cord, Evrysdi is administered orally, either as a liquid or in capsule form, making it a more convenient and less daunting option for patients of all ages. This ease of administration marks a significant milestone in SMA treatment, improving accessibility and adherence to therapy. Evrysdi's arrival has been met with immense enthusiasm from the SMA community, as it offers a promising new avenue for managing the disease and improving quality of life.
To understand how Evrysdi works, it's helpful to revisit the genetic basis of SMA. Spinal Muscular Atrophy, or SMA, is a genetic disorder that affects the motor neurons in the spinal cord, leading to muscle weakness and atrophy. This condition is primarily caused by a defect in the SMN1 gene. As mentioned earlier, SMA is caused by a defect in the SMN1 gene, which provides instructions for producing the SMN protein crucial for motor neuron survival. Without sufficient levels of this protein, motor neurons deteriorate, leading to the severe symptoms associated with SMA. Humans have a backup gene called SMN2, which also produces SMN protein, but in a less functional form and in smaller quantities. The SMN2 gene is almost identical to SMN1, but due to a slight difference, it produces a truncated, less effective version of the SMN protein. Evrysdi acts as a molecular lifeline by targeting this backup gene, SMN2. It is designed to modify the splicing of the SMN2 gene, allowing it to produce more of the full-length, functional SMN protein that the body needs. It works by increasing the production of functional SMN protein from the SMN2 gene, effectively compensating for the deficiency caused by the faulty SMN1 gene. This increase in functional protein helps to stabilize and maintain motor neuron function. By boosting the levels of functional SMN protein in the body, Evrysdi helps to preserve existing motor neurons and may even promote the growth of new ones. This is crucial because motor neurons are responsible for transmitting signals from the brain to the muscles, enabling movement and coordination. This increase in functional SMN protein can lead to improvements in muscle strength, motor function, and overall well-being in individuals with SMA. Patients may experience enhanced mobility, better respiratory function, and an overall improved quality of life. The goal of Evrysdi is not just to halt the progression of SMA, but to provide patients with the opportunity to lead more active and fulfilling lives.
Two pivotal clinical trials, Firefish and Sunfish, have played a crucial role in highlighting the transformative potential of Evrysdi. These trials have not only provided hope, but have also set a new standard in the treatment of spinal muscular atrophy, or SMA. Firefish focused on infants with type 1 SMA, the most severe form of the disease, which often leads to significant motor function impairment and a high mortality rate within the first 2 years of life. While Sunfish included children and young adults with type 2 and 3 SMA. These types are less severe, but still result in substantial physical limitations and require ongoing medical care. The results of both trials were incredibly encouraging, offering a new lease on life for many patients and their families. In Firefish, infants treated with Evrysdi showed significant improvements in motor function, which is a critical measure of the drug's effectiveness. With many achieving milestones like sitting without support, a developmental achievement that is rarely observed in untreated infants with type 1 SMA. This milestone is particularly significant as it indicates a substantial improvement in the quality of life for these infants and their families. The Sunfish trial also demonstrated substantial benefits, showing that Evrysdi is effective across a broader age range and different severities of SMA, with participants experiencing increased muscle strength and improved motor function compared to those who received a placebo. This improvement was not just statistically significant, but also clinically meaningful, impacting daily activities and overall well-being. These findings underscore the remarkable impact Evrysdi can have on the lives of individuals with SMA, providing them with opportunities for greater independence and a better quality of life, regardless of their age or disease severity. The ability of Evrysdi to benefit such a wide range of patients makes it a versatile and invaluable treatment option. The positive outcomes observed in these trials have solidified Evrysdi's position as a beacon of hope in the fight against SMA. It represents a significant advancement in medical science, offering a brighter future for those affected by this challenging condition.